The recent spike in COVID-19 cases has left more than 100,000 Americans hospitalized. According to the U.S. Department of Health and Human Services, roughly 18,000 of those hospitalized are in intensive care units. Hospitalization rates are the highest in New Jersey, Ohio, and Delaware. The FDA is now allowing children as young as 12 to get the Pfizer booster shot. The move coming as school is set to return after the holidays. The FDA says anyone 12 or older can get the Pfizer booster 5 months after their last dose, instead of the initial 6-month recommendation. A CDC panel is expected to vote on the decision this week, the final decision coming from CDC Director Dr. Rochelle Walensky. The CDC is also considering amending its new 5-day isolation guidance. That's according to Dr. Anthony Fauci. The recommendation is for the guidance for asymptomatic patients to include testing. The CDC cut the recommended isolation time from 1 day to 5 days last week. The guidance also includes wearing masks in public for the 5-day period, but the requirement for a negative test result was dropped. Joining me now to talk about the latest on the coronavirus is Dr. Patrice Harris. She is CEO and co-founder of eMed, a health tech company, and she's also the immediate past president of the American Medical Association. Dr. Harris, welcome to Black News Tonight and Happy New Year. With the rise of COVID cases, many people with compromised immune systems are getting unapproved 4th and 5th COVID shots. They're taking the 4th and the 5th. Some of us are just getting our 3rd. Is that safe?
Well, first of all, Happy New Year to you, Mark, and thank you for having me. Let's step back and remind ourselves what the vaccines do, right? They teach our immune system to rev up when our body is invaded with the SARS-CoV-2 virus. But those whose immune systems are compromised, who don't work as well, they do need extra doses. Science has demonstrated that. But you are right. At this point, the 4th and the 5th dose are not officially approved by the FDA and CDC. But Mark, sometimes decisions like this are best left, actually all the time, best left between the doctor and the patient. So those who are immunocompromised need to discuss this decision to get the extra dose with their physicians and then make those decisions.
Which makes sense to me. You know, right now, when you get the booster, under normal circumstances, you're getting half the dose of a single COVID shot. So you got the first shot, and then you got the second shot 3 weeks or a month later, depending on whether you had Pfizer or Moderna. And then now for the booster, you're getting a 3rd shot, but that 3rd shot is half the quantity of a single of the initial shots you got. So it's really like 1/4 of what you initially got. That's why some of you people aren't, getting the same kind of reactions they got to the first one. But if you add 2 unapproved doses, you doing double the booster dosage twice. And like you said, it's between a doctor and a patient. So I just want to be very clear out there, because these people that are doing the unapproved doses, sometimes they're just going and getting in line and signing up for COVID, for the COVID shot, as if they never got one before. They're basically saying, I'm John Smith, and next week I'm Juan Smith, and I want my next 2 shots. That is unadvised. Anybody watching this, do not go out there and get 2 shots that your doctor didn't tell you to get. And if you got 2 shots, get your booster, but don't get 2 new shots. Am I correct on all of that, doctor?
Absolutely, absolutely. These folks who are immunocompromised should be talking to their physicians about this. I'm sure their physicians can take their antibody levels to see, how strong their immune system is reacting to the vaccine. But you are so right. Again, only consider this if you have made this decision with the consultation of your physician. But do, everyone out there, when you are eligible, get your vaccine and get your booster. I've had all 3 shots and I feel so much safer. So I just want to say vaccines are the best way to get this disease. Get your vaccines.
I got my vaccine, I got my booster, and I feel so much better. The FDA is now expanding the booster shot for Pfizer to children 12 and older. Will this help us? Kids are going back to school after the holidays. People done had their New Year's parties. People done had their Christmas stuff, and the Rona's out there. Does the 12-year-old and up vaccine help us out?
Great news. We continue to make progress. The more people in this country of all ages who get the vaccine, the more we will be able to work our way through this pandemic. It's the unvaccinated who are at risk for I say the SARS-CoV-2 virus percolating out there and forming more variants. It's the unvaccinated that are at greatest risk of significant disease, hospitalization, and death. So there's good news, and we want those children to get vaccinated. You just mentioned that many districts are going back to school. Here in Atlanta, we're going to start with distance learning. But there's no question that we need to get our kids back in school. But you know what? We can do that if we act, if we get everyone vaccinated, if we test appropriately. And just so you know, I am the co-founder and CEO of EMED. We developed a platform for rapid at-home testing. But if we get vaccinated, if we test, if we wear our mask, and if there's appropriate ventilation, we can keep our kids in school.
Absolutely. Before we go to CDC said it might be adding testing to its isolation guidance. Do you think that this will soothe many of the concerns people have with lowering the isolation time? Because the CDC has been getting dragged all over the internet. The jokes have been on 100,000 trillion for the last 2 weeks or for the last week after the CDC lowered the guidance or shrunk the guidance time. Do you think that adding testing to this will make people feel better that, okay, now they're saying 5 days, they were saying 14, then it went to 10. Now, now it's like 7, is it 5? But if we say test, whether it's antigen or PCR testing during that process, will that make people feel better?
As a former public health official, I certainly appreciate and value the CDC, especially being here in Atlanta. But I was one of the many public health officials and physicians who said, we probably should have added testing because, yes, some people after 5 days will no longer be infectious, but not everyone. And so we want to make sure that if you're going back to school, if you're going back to work, you need to get tested. And unfortunately, as you know, you've seen the long lines. I was driving today and saw several lines miles long. That is unfortunate. And we have to make sure that state, local, federal officials make sure that testing is equitably available. As I say, we need to make the right thing to do, the easy thing to do. So we need more access to testing, no question. And we need to add that back to the guidelines regarding infectiousness and return to work and school.